I'm VJ Hamilton and welcome to the Autoimmune Reset, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to the Autoimmune RESET Podcast. I'm your host, VJ Hamilton. I'm a nutritionist, scientist and expert in autoimmune disease. And today I'm very excited to have Dr. Kelley on the podcast. She is the founder of Case Integrative Health, and she is a medical doctor but also trained in functional medicine, which I find a lot of medical doctors are doing these days, looking at the root cause rather than symptoms. Casey has her own story to share as well, which I'm excited to hear about. But welcome, Casey. Thank you for being here.
Oh, it's such a pleasure. Thank you for having me.
Now, where I like to start with guests is to talk about your own story, because often we get into this because we have our own problems or we've had our own issues in the past, and I know that was the case for you as well. So would you be able to tell us a little bit more about your story, please?
Yeah, absolutely. And my story is not all that unique. It's the one that I hear a lot, actually, where I was dealing with a lot of chronic kind of complex issues and I couldn't find the source and the reason. So it actually started in college where I wasn't as active as I once was. I couldn't walk up the hill to my dorm without being short of breath, which was really odd. And I got diagnosed with asthma, which was not what it was, but they didn't know what else to do for the shortness of breath. And then it developed into chronic fatigue and POTS, postural orthostatic tachycardia syndrome, where I would stand up and my heart would be really, really fast and I'd feel really dizzy and I almost passed out a few times, couldn't think straight, and it just got progressively worse. And so I went to med school and kind of suffered through all of this. And in med school is where I got diagnosed with POTS. And I took different medications and things to just kind of get myself through Band-Aids, really to kind of get through residency. It was after residency that I got into integrative and holistic and functional medicine, and I started to learn about Lyme disease, and it took me a while, and I finally got tested and got diagnosed and got treatment and feel so much better. But it was a journey, and I really had to trust myself and kind of keep looking, because I knew there was something else. I knew it wasn't just you're tired because you're a med student. Yeah. It was more, and I knew that. Yeah.
I know. I first noticed my chronic fatigue syndromes around university. I think you're pushing yourself so much, but then there's other people who are doing exactly the same thing as you, but being able to cope with it. And for a long time, I always thought it was me, and I had this issue. I was almost like born with it. But yeah, there's often an underlying issue, which we'll definitely talk more about. But there's quite a lot there, and for people that might not have heard of POTS, it'd just be interesting for you to share that, because it's I feel that it's underdiagnosed really, and there are lots of symptoms that people might not identify with being related to that.
Yeah, so POTS is postural orthostatic tachycardia syndrome, and it's an autonomic nervous system dysfunction. And there's varying degrees and there's different types, but essentially, when we stand up, our body naturally will adjust. Your blood pressure will adjust to that shift in gravity, and your heart rate and things will adjust so that you make sure you're still getting blood to your brain, and your body does that all automatically. You don't have to think about it. You don't feel dizzy when you stand up. It's a beautiful, beautiful system. But for me, my POTS was the tachycardia. So I would stand up and my heart would start to race 120, 140, 160 beats a minute, just simply by standing. That, also I was not getting enough blood to my brain, so I would feel dizzy and lightheaded, and you can actually pass out from this as well. That's and then that's the syncope part of it. And there's different kinds. And so some people will have adrenergic POTS, where it's, a cortisol issue, an adrenal issue that kind of revs everything up. And other people will have the passing out bit. So not everybody does, but it can lead to other symptoms. You can have GI issues and sleep issues and pain and other things associated with it as well. But at the end of the day, something set off the nervous system, the autonomic nervous system, which is our fight or flight, rest and digest system. So it was no longer connected and talking and working the way it was supposed to. And it just kind of leads to a host of issues and symptoms.
And is that why, I mean, you're obviously on this conventional path. Is that how functional medicine was introduced to you? Were you looking at ways to deal with this? And it sounded like you were, to understand actually what's at the root of this.
Yeah, I actually kind of started down the conventional road as a med student to figure this out. And I had a tilt table study where they strap you to a bed and raise you up really fast and monitor all of your vital signs to diagnose it. It's an awful test. It was not a fun day. And, I started with conventional medications and things to try to mitigate the symptoms, but they caused their own side effects and their own issues. And I just found that there was a lack of curiosity. Why is this happening to me? Where did this come from? This didn't just come out of the blue. And so that, I think, did lead to some more, digging in and finding that. And so in med school is when I really started to get into the why. Why does someone have diabetes? Why do they have this? Why aren't we asking these questions? Why are we just so quick to diagnose and give a medicine that has side effects? So then we give more medicine, which has side effects. So we give more medicine. That doesn't make sense to me. So that's where I really started to go down that track and look for more holistically minded individuals and go to conferences and really teach myself about that aspect of medicine.
So what did you find out about yourself then? You mentioned Lyme disease. What else came up for you as some of your root causes?
Yeah, I really think my adrenals were shot. The stress of college and med school, and I lost my mom as well. And there's just a lot of stress. And when you work those hours, a 30-hour shift, there's no downtime. And, people's lives are literally in your hands. It's a very, very stressful period of time. Cool. And that, I think, just exacerbated everything for me, not being able to sleep, not being able to rest properly, and not being able to heal. And so it just prolonged and exacerbated all of my symptoms. And so getting my adrenals to work better was one of my first forays into my health. And then my gut was number 2. I had all kinds of digestive issues and dysbiosis and SIBO and probably CFO, which is a small intestinal bacterial overgrowth, or a small intestinal fungal overgrowth with bloating and gas and constipation, diarrhea, all kinds of fun stuff. So I did dietary changes and I worked a lot to get that under working order and felt better, but there was still something missing. I was kind of got those foundations going, but there was still some other things in there. And that's when I had been to a couple lectures and heard, specifically Dr. Horowitz, but other doctors talk about Lyme and co-infections. And at that time, it was still very, very scary almost to treat that as a physician. It still is, because it's so misunderstood. And there's a lot of stigma and doctors losing their license for treating this. So it took me a while to be brave enough to test and then to start to get treatment for that. And that's when I really started to heal. Okay.
And so during this time period, what were you doing work-wise? Had you started kind of moving into functional medicine, or were you just doing all this on yourself to begin with?
Mm-hmm. Yeah, no, I got right into it. So after residency of family medicine, I did a year of urgent care, and then I started working at an integrative clinic, and I have been in integrative medicine since then. Yeah, started my own practice 6 years ago to be able to help patients with chronic complex illness, as well as people who just want to, crank it up a gear and, live longer and have better quality of life and that as well.
Yeah, I think when you're helping people with autoimmune disease or chronic illness or these chronic infections, it's almost the same thing that you'd be doing with somebody to help them with longevity and to live longer. Because I find that space so fascinating, but I do find like helping people who have, I'm sure the same as you, been through a similar path as you have, is really rewarding. Let's talk about your clinic then, because obviously you set up your clinic, you're obviously really passionate about what you're doing. So if somebody comes to you in a similar position to what you were like when you first started with unexplained symptoms, what's your first kind of go-to approach with that? If somebody's got a lot of different symptoms coming up and you have no idea what could possibly be the underlying root cause, or you might do based on your experience.
Yeah, I usually do. With chronic complex illness, it's usually one of a few things. So it's usually some sort of chronic infection, some underlying toxin burden, nutritional deficiency, and some stress, neurological, immune, trauma type issues as well. And it's usually all of the above, kind of in there. But my first thing is always I'm curious, and I'm a little bit of a medical detective. And so I want to ask as many questions as I can, kind of starting from the beginning and working my way through. If I have a chance, I go all the way back to birth and when they were in their mother's womb, even asking those questions. But going back to the beginning of their symptoms and even a little bit before, and kind of what started it, what was triggering them, what was going on in their lives, what has happened since then, and really kind of digging into that history, because you get so much information in that. And then I do do a lot of testing. I really do. I try to use insurance as much as possible, but I'm known to draw 20 or more tubes just to really get a broad net. I kind of send out a broad net and see where I can go next. Because like I mentioned, it's usually more than one thing, but the labs can sometimes help me figure out too, which one I should start with, which one's louder, plus the history, where do we weave from here and where do we go?
Yeah, I love functional testing as well. I just get so excited about seeing my clients' results and like pulling together the full picture. So what are your go-to labs really when you're working with clients? I know it's hard to say that, but I think as practitioners, we often have some favorite ones.
Well, I'm a Lyme doctor, so I almost always doing a Lyme panel and a vector-borne illness panel on almost everybody. I love to do gut studies to get a good kind of solid groundwork and see what's going on in the gut. Even if you don't have GI symptoms, it can be a really good place to start. If you have neurological symptoms, headaches, fatigue, brain fog, sometimes it's all coming from the gut. So I do like to look at that. I do several immune markers as well. They're in the Lyme SIRS world or mold illness world, things like C4A, C3A, CD57. I'm just kind of looking TGF-beta, where the shifts are, where the imbalances are, which way the immune system is headed. ANA, which is kind of a generic marker for autoimmune disease, is one of my go-tos at the beginning as well. And I'll look at some nutrients, folate, vitamin D, sometimes zinc and copper, magnesium. Where are there big obvious deficiencies there that might lead to some explanation of the symptoms as well? Yeah, and then, from there I can kind of build and do more and more. Adrenal testing. I do organic acid testing as well, which is a urine test. So it builds. Yeah. I try not to do all of it on the very first visit. I try very hard not to, but I do a lot, usually at the beginning, so I can get a better handle on where we are.
Those immune markers are really interesting that you mentioned. So how are they important? And because there'll be a lot of people listening that maybe never even heard of some of those markers before. Would you be able to explain them and why they're relevant and why somebody should be thinking about testing those?
Yeah, so one of my favorite combos is C3A and C4A, and it's not the same as C4 and C3. They're very specific markers, and they're very specific labs that draw them. Specifically C4A, it's got to really go to National Jewish Laboratory here in the States. But these are complement cells, and complement cells are part of our immune cascade, and the C4A is related to anaphylaxis and those type of immune reactions. But I really think of it as a toxin burden marker, and there are certain biological toxins like mold or Lyme. There's a couple others, blue-green algae, dinoflagellates, things that will elevate C4A. And if those levels are really high, there's a big toxin burden likely in the system. And sometimes the ratio or the combination with C3A can clue us into if it's mold or Lyme. C3A, if it's low, and C4A high, that's mold usually. If they're both high, it's usually more of an infection driving it. So that can be useful to kind of help gauge, again, which one is louder in the system, if you will. CD57 is a different kind of white blood cell. It's called a natural killer cell. It's a first line of defense. And it is implicated with Lyme. Lyme is not the only thing that will affect it. It's certainly not a diagnostic test by any means. But I do find clinically when patients are pretty low in that number, they can sometimes have a harder time mounting their own response and fighting the infection. So I can gauge how long I think it's going to take to really see benefits. If they have a robust CD5 and a robust kind of natural killer side of things, they tend to respond better, faster to treatments. That's not always true, but that can be a useful tool to kind of wrap my head around how complex this is going to be to get ready.
You're making some really valuable points here, because I think a lot of the time we think about an autoimmune condition, or it's definitely what we see in the media, that we need to suppress our immune system. Actually, a lot of the medications are about suppressing our immune system. But if you have mold or an infection or some other toxin, you want your immune system to be pretty strong, don't you? So what's your thoughts around that? Because I think generally we think about autoimmune disease as suppressing the immune system, but really what I see is people with already suppressed immune systems are getting autoimmune disease. Yeah. So would you be able to touch on that? Because I think it's such an important topic. Yeah,
the immune system is very, very complex, and it's probably smarter than I will ever be. The way that it can balance things, and it's more than a teeter-totter. So just, sometimes I'll simplify it in my mind with, one side of the teeter-totter is fighting self, an autoimmune disease where your immune system is attacking yourself, and the other side is fighting infections, kind of the crime fighting side of things. But it's more like a wagon wheel. There's a lot of different spokes and things in there, and it's all about balance. So when it's shifted too far towards the autoimmune side and you're attacking yourself, we want to try to shift it more towards the crime fighting side. So it starts to actually fight off the infections. And things like Lyme, for example, are so smart. They actually on purpose activate that part of your immune system, the autoimmune side of your immune system. So the immune system will leave Lyme alone, and it can sit inside your cells and do it at once. And the immune system will leave it alone because now the immune system is activated outside of your cells and attacking self. It's actually terrifyingly brilliant in that it does that. But yeah, so we don't want it shifted one way or the other. We want it to be able to be mobile and balance. And then it's when it gets kind of stuck in one area that we want to try to unshift it. So it's not about suppressing necessarily, it's about modulating and balancing, which is...
And how do you deal with that? Because obviously you work with a lot of clients that have Lyme, a lot of patients that have Lyme disease. So how do you work on modulating that and bringing the balance back in the immune system? Have you got some kind of go-to protocols that you use?
It's so patient dependent and specific because there's always so many different factors at bay. And so for some patients, it is more autoimmune. So one of my go-to aspects there may be something like low-dose naltrexone. So this is a medication that will help to reset that balance and kind of get it back towards the crime fighting side and less on the autoimmune side. So that can be a wonderful medication to use to help rebalance that without completely suppressing the immune system. I also have a lot of patients that have mast cell activation from all of this. So their mast cells, which spit out histamine and other inflammatory cytokines, just don't turn off. So they become hyperreactive and hivey and flushing and motion sickness and dysmenorrhea and all these other issues because that aspect is high. So then I try to kind of calm those cells down and resettle those cells. There are herbs like quercetin and nettles that can help settle and calm mast cells. And there are medications like ketotifen or cromolyn that can also help to stabilize those. And we'll use antihistamines and things as well. But we're trying to balance and trying to calm down those cells and stop them from overreacting so that everything else can kind of get into better balance.
Yeah, I mean, there's some great tips. And obviously, anybody that's listening, any of these types of supplements or medications, or, refer yourself to your own doctor or practitioner. But they're just such, I see this a lot, especially with MCAS. And one of the aspects of this really, and we're talking about like a heightened response from the immune system a lot with autoimmune disease, and what I see hand in hand is a heightened response from in terms of your nervous system and the stress response. So how important is it to regulate your nervous system and build stress resilience when it comes to recovering from these types of conditions?
It's imperative. It's imperative. And it's different parts of the journey require different aspects to that. And it's a part of the conversation with every patient along the journey. And sometimes, it's at the end even where we miss the fact that when we've been sick for so long, we're used to being sick and we kind of embody that and we almost don't know how to be healthy anymore. So that once we've kind of managed, like we have to retrain the system and reteach the nervous system that it's safe to be healthy and it's okay to feel good. And that can be like a big leap for us. And it's a very subconscious issue. Our brain and our immune system and everything just really wants to protect us and keep us safe. And it can get stuck in those trauma loops where it just spits out inflammation. And so it's imperative, like repairing that fight or flight system in the vagus nerve and the limbic system where our emotions are in our brain it's paramount to treating the entire system. And it's a big part of the healing journey at different aspects on the way, but it's a big conversation that we have to have.
Yeah.
And the people who do that work get better, faster, stay better longer.
And is that part of you, because you've got a program, don't you, Groundwork for Healing? Is that part of that program that you go through how to build more stress resilience and tools to do that?
Yeah, it is. So Groundwork for Healing is an online course that I created for patients who have chronic illness and need a place to start. Or who need a place to reset. And it's going back to those basics. It's making sure you're eating the right foods and moving to your best of your ability and helping with sleep and detox. But stress is a big, big part of that. So we do touch on it in that course. I'm planning to create a bigger course related to it. And there certainly are programs that we talk about. Primal Trust is one of my favorite that I will refer patients to utilize to kind of really dig into this work in a deeper way and use different tools to reset the nervous system. And it doesn't have to be hours a day. I think that's a part too where we are like one more thing. Can't add one more thing to my list. And especially with stress as a working mom, like I can't add one more thing to my life, but I could do 5 minutes. I could do 5 minutes, or I can do some breathing when I'm at a red light. and I'm driving my car. I can do some of these things on a regular basis that aren't extra, to start to work on that process and healing that. And when you see those little changes and what can happen even when just you change your breath on a regular basis, and it's easier to want to do more.
Yeah, it makes such a difference, doesn't it, with the breathing. I trained as a Pilates instructor as part of my recovery, and she was just like, you're shallow breathing. And I'd never noticed, but I think I'd just been shallow breathing my whole life. Yeah. And just realised, I'm not breathing right, wasn't breathing right on a night. So have you got, I mean, actually that brings us nicely on to sleep, and actually, if somebody is thinking about doing more breath work, because I think people think when you say breath work, you mean something quite complex, like different types of like yoga breathing, but actually, what are we talking about here when it comes to breathing?
I call it 4-8 breathing, and it's just some deep breath to kind of bring you back to that diaphragm, to really use your abdomen and kind of calm and reset the nervous system. I use 4 and 8. There's also box breathing, which is more 4, 7, 8 kind of things, but as someone who had trouble breathing due to babesia and other issues, that kind of breathing actually made it worse. So I kind of modified it for myself, but I breathe in deeply through my nose and get my abdomen and my diaphragm to expand, and then breathe out through my mouth for 8. And I try to remember 4 to 8 times in a row, 4 to 8 times a day. And I use clues like when I'm at a red light.
Yeah.
Remind myself to do it, or when I'm in the bathroom. And just those resets can start to bring some of that relaxation back to the system, which can help with stress resilience and sleep and other things too. And it's a simple way. It's free.
Yeah.
And we all need to do it, because we're all very shallow shoulder breathers.
Yeah. And in terms of sleep, how do you find, I'm sure a lot of your clients are coming to you, especially when they've had a chronic illness and they have sleep issues. What are your go-tos when it comes to sleep?
And they can be really hard to fix these, because especially when you're so tired and you want to sleep and you can't sleep. It's this cruel joke, right, of nature that occurs with chronic illness. So there's not just one thing that will fix it. And I do think sometimes it is warranted to have a sleep study, even, for example, to find out if you have sleep apnea or other things. Sleep hygiene is very important. That's an easy one, but we're often, that's nighttime is kind of our time. And so we stay up too late. We watch our screens, we're taking advantage of that time. And if we took advantage of it in a different way and got ourselves ready for bed, and we have kids, we have to give them a bath. We read them a story. We settle them down from the day, right? And we don't do that as adults. We're going, and then we watch our phone and we watch our TV and we answer our emails, and we're just like, why can't I sleep? I don't understand. Why am I not tired? So you have to go back to that. You have to kind of give yourself that and turn off your screens and maybe take an Epsom salt bath, read a book, listen to a meditation, do soothing, calming stuff to get ready for bed and really get ready for bed. And that can go a long way in kind of shifting that, instead of staying up and doom scrolling.
Yeah.
Try to make some other efforts to start to unwind and get yourself into that sleep.
Yeah, it makes such a big difference, doesn't it? But it is hard to get out of that routine, because I hear it from clients, and I know from my own experience as well, that when you have like a free half an hour on a night and that's all you've got, you might want to catch up on what's going on social media or TV. But actually, if you have that routine, it's made a huge difference to my own sleep. So yeah, that's really great advice. Well, I know a lot of people have worked with you and done amazingly well and being able to completely reverse their symptoms. But I know there's a lot of fear, isn't there, around relapses. I get that a lot because I work a lot with alopecia, and a lot of the time people are very worried about the hair coming out again, even when they're better, and you don't want to live in fear for your whole life. So how do you help people with that kind of more health maintenance after they've got better and recovered?
Yeah. I think that goes back to repairing the nervous system, and that bridge between sick and healthy, and retraining your system. And again, that fear is a very subconscious way that our nervous system and our body's holding on to that to protect us, and it doesn't have to anymore. And you're not making it up. It creates very, very real physiological issues, but the good news is we can repair it and we can retrain it, and we can say, thank you, you're trying to protect me, I love you, thank you, brain. Now it's time to shift. And it takes some work. It's like a muscle. You have to rebuild it and retrain it. But if you can do that on a regular basis, and even just, fake it till you make it type of stuff. I love you, brain, I'm safe. Nope, I love you, brain, I'm safe. My hair is good. It grew back once, it will grow back again. We've got this. And it sounds so silly, but it's so simple too. And just over and over and over and over again. And there are other programs and things out there too that will help with that. But that is a big part of that. So once we get better and the hair is back and we're doing that, how do we stay there? How do we train our system now to embrace this safer, healthier spot. Yeah.
Safe is the word, isn't it? And I know when I've had like little niggles come back, I've just said to myself, my body has the most amazing ability to heal. And I just repeat that. And it's true. Our bodies can heal when we give them the right things. But, that safety aspect is so key to this.
Yeah.
And I feel a lot of people feel unsafe and anxious and have a lot of anxiety around it.
Understandably so. Yeah.
I mean, I know when I was recovering, I've done all sorts of things along the way, and I've changed my mind about things as well. And I really believe in keeping an open mind, because actually science changes, doesn't it? And you've got to, be open to that. Is there anything that you did at first when you were recovering, or anything that you've done with clients which you now realize probably wasn't the best thing, or things have improved in a certain area in what you're doing with Lyme disease and other chronic illness?
That's a great question. I think one of the tenets of my practice is innovation, where we kind of thrive on that, and we really want to always be learning and finding new tools. I'm also very skeptical, so I'm not just going to bring in anything. I'm willing to try stuff and learn about stuff, but certain things like peptides and SOT and even ozone to a certain extent, I would learn about them and I read about them. I go, that sounds amazing. I need to do more research. And sometimes it takes me a couple years to really feel safe and confident that this is a valuable tool to learn about and bring about. But through that, I've been able to add so many new things, and patients bring some of this information to me too. Have you heard of this? Have you heard of that? And so, because our patients are so savvy, they do so much research and they know so much, and I love learning from them as well. And I just love learning. So I'm always looking for new things and always trying to bring things in. And I can harken back to my days in urgent care when I can see a rash on someone's leg. I can see it in my head now that it wasn't hot. It looked like cellulitis, but it wasn't hot and like cellulitis is. It was red. But looking back now, I go, you know what? I probably missed Lyme disease in that patient. That was probably from a tick bite.
Yeah.
And I missed it. And I didn't know about it because it wasn't a bullseye. And, those are the things that kind of bug me, if you will. But that's just part of the evolution of learning about all of this, and being okay with that, and learning from that, and growing and adding new things along the way, which is part of the fun too, and kind of getting that in there. So I'm never afraid to learn new things, but I do always want to be skeptical and make sure that it's not just a fad. It's got some solid research and science evidence behind it, and that we're using safe, effective tools.
Yeah. And what's your favorite tool that you're using outside of nutrition at the moment, and supplements, medication at the moment?
Right now, we're seeing really good responses from SOT, supportive oligonucleotide therapy, which is pretty cool treatment to help fight off these infections. Very, very tailored aspect to kill. Yeah. To kill the bugs so they can no longer grow and replicate, which has been a really fascinating addition to the practice. And it is helping us help patients get better faster. And monitor it and build through that and help that process. We're seeing some changes. So if we can cut off a couple of years to the treatment, things like that in a very safe way are huge. So that has been one of our biggest tools over the last couple of years that we've really seen some cool changes with.
Amazing. If anybody is feeling a bit dismissed, because this can happen, can't it? They might suspect, they've just listened to this podcast, they might suspect that they have Lyme disease or some kind of chronic infection. What's a good first step for them? I mean, coming and contacting you is probably a good idea. But where do you go, especially when you've kind of been to see doctors and they're not, taking on board that you're having these symptoms? I think this happens to so many people, doesn't it? When they have an autoimmune condition or chronic illness, it can take years. So what would you recommend doing as a starting point?
Yeah, you have to be your own best advocate and really find a provider and keep going until you find a provider who will listen and be your teammate. And usually that's going to be more of the integrative functional medicine doctors. So you could go to the Institute for Functional Medicine, you can go to the American Holistic Medical Association, you can go to ILADS, which is the International Lyme and Associated Disease Societies, and you can find providers on those websites that are going to practice in this way. And you should be able to find someone close to you or who will see tele patients or things and kind of dig into it. And if they may not have all the answers, but those integrative and functional docs are the docs who are willing to really look under and look for those root causes. And so they might still be able to help you find it, and then they can help also maybe refer you to someone who has better expertise in X, Y, or Z that you have going on. But someone who's really willing to listen, I think is important. And sometimes you have to kiss a couple frogs before you find your prince, but you don't stop. If you know there's something happening and it doesn't feel right with you or your child, you have to really go out and continue to look. Another one for children is MAPS. It's actually medmaps, I believe, .org. This is for the Medical Association for Pediatric Special Needs. So there are groups out there of physicians who are dedicated to finding the root causes. So I would go to those websites and try to find someone in your area that practices like this and who will listen and hear you and try to find this root cause with you.
Yeah. And on that note, where can people find you if they want to find out more about what you do, find about your program that we talked about, which is Groundwork for Healing? Where can they go to find you? Where's the best resource?
Yes, our website is caseintegrativehealth.com. You can also go to healwithcase.com to find the course. You can also find us on Instagram, Facebook, all that fun stuff as well. And we have a discovery call as an option. So if you want to find out more about what we do and if you're a good fit for us, you can do that free of charge and learn more about us and see if we're a good fit.
Great. And I'll put all the links to that in the show notes as well. Well, thank you so much, Casey. This has been such an interesting conversation. I've loved having you on. Hopefully, I'm sure we'll get together at another time. But yeah, thanks so much for being a guest today.
Thank you. Yeah, I'd love to come back. This was great.
All right. Well, have a great day. Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time, and remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.